Did you know that our mind can be both protagonist and antagonist in our lives? Good day and welcome to Mind Matters! Hello there! In this Mind Matters tutorial, we're ready to know about the cognitive behavior therapy, also known as CBT. I'm Lindsay, as future psychologist, and welcome to this Mind Matters tutorial. And I'm excited to walk you through how CBT works. Before that, let's look at the learning objectives. Learners should be able to learn all of this at the end of this video. Number 1, define CBT. Number 2 is identify theories related to CBT. Number 3 is explain the triangle method. Number 4 is the last one, apply CBT techniques in simple real-life scenarios. Now, let's talk about what is CBT. According to Chand et al. 2023, cognitive behavior therapy or CBT is a combination of cognitive and behavioral therapies serving as an evidence-based approach designed to reduce psychological distress and dysfunction by examining how persons' thoughts, emotions, and actions interact to contribute to their current circumstances. Cognitive behavior therapy is a type of psychological treatment that is successful in treating a variety of issues, such as depression, anxiety, eating disorders, marital issues, alcohol and drug use issues, and serious mental disease. Several studies indicate that CBT significantly improves functionally and the quality of life of that person who is experiencing different kinds of disorders. Numerous studies have shown that CBT is just as effective as other psychological theories or psychiatric drugs. Now, let's talk about the history of CBT. CBT was developed in 1960s and 1970s by our co-founder, the late Dr. Aaron V. Beck. It is a type of structured thought therapy that teach people to identify and change harmful thought and behavior patterns so that they can better handle difficult circumstances and enhance their overall quality of life. Dated in the history of CBT, Beck Institute Cares 2023. During Dr. Beck research, he found out that the depressed patients often experience negative thoughts about themselves, the world, their reactions, their actions, and their future. This recognition and thoughts lead Dr. Beck to refer to them as automatic thoughts, since they seem to occur on their own like a fixed path. The depressed patient would concentrate on these negative automatic thoughts, which led to both bad emotions and poor behaviors. Now, let's move on to the triangle method. In CBT, they use the triangle method, which shows the connected components. The triangle situation is at the top of the triangle. Thoughts, it's in the right side. Feelings is the under or the below of triangle. And the behavior is in the left side of the triangle, wherein situation represents the event or experience that happens in real life. And the thoughts are your reasoning, interpretation, and beliefs. And this is often automatic response. Feelings stands for the arising emotions that results from your thoughts. And lastly, the behavior, which discusses how you will act and respond based on a combination of thoughts and feelings. So, as you can see on the screen, they form like a triangle cycle. It can be also a circle since they are all connected. One change on this can have a domino effect. I want to give an example of this. Let's say you're in a situation where it happened to me before when I was in high school grade. The situation is you see your classmates laughing while looking at you. Of course, your automatic thoughts will play, wherein you will think that they don't like me, they think I'm weird, I did something embarrassing. Because of this, you will feel different kinds of emotions. You're going to feel, you will feel ashamed, anxious, insecure, embarrassed, anxiety, and etc. And it can lead to changing behavior like avoiding eye contact, withdrawal from classmates, and overthinking the situation that happened. However, in CBT, these thoughts, feelings, and behaviors or patterns can be changed from an old cycle to new cycle. Let's say from a negative cycle to positive cycle. From old cycle to new cycle. From negative to positive. The situation is you see your classmates laughing while looking at you. It's the same situation. You are in a situation again, but you're not gonna do what you did in the old cycle. First, you will analyze the situation and its context, and after analyzing it, you will make a final thought, just like they are probably laughing about something else. And I don't have enough evidence to assume that it's about me. And you will feel less anxious, more calm, and confident because you're not thinking about something else. And the behavior that you will act or respond is does not overthink as much as possible and continues to socialize inside the classroom, which is peace of mind. As you can see, in the new cycle, it changed from the negative to positive, taking on the role of analyzing and identifying the situation. It worked that way because CBT has three important parts of cognition. The first one is automatic thoughts. These are the quick thoughts that enters a person's mind during certain situations and often happen without their conscious awareness. Example of this is you see your classmate laughing and your automatic thought will be they are laughing at me, they are laughing because of me, like that. So the second cognition is the cognitive distortion. Exaggerated ways of thinking in a given situation. There are many types of it, but let's talk about the common ones. The mind reading and overgeneralization. The mind reading is you are assuming that what others will think about you. Example is, this is so embarrassing, everyone will hate me now. And the overgeneralization is one negative experience and you will apply it to everything that will happen to you. Example is, they will always laugh at me now. The third one of cognition is underlying beliefs. It talks about the beliefs that you hold about yourself and the world. For example of these is, I should look prettier like them. In psychology, CBT is frequently used to support individuals who are managing stress, anxiety, phobias, trauma, depression, obsessive compulsive disorder or OCD, and other mental health issues. It helps people to become more aware and able to regulate how we respond to situations as soon as we become conscious of our thoughts. Overall, cognitive behavioral therapy helps us build strong communication and connection among our thoughts, feelings, and behaviors. The lesson we tackled earlier help us see how thinking patterns and environmental factors influence human behavior. And applying the technique of new thought or new cycle can improve their mental health and develop a healthier way of thinking that will improve their overall life. Before I end this video, I want you guys to get a piece of paper and write down how have you been feeling today. Are you done? Once again, I'm Lindsay and thank you for staying until the end of this video. I hope you learn a lot about cognitive behavioral therapy in this session.